Welcome to the University of Michigan Dentistry podcast series, promoting oral health care worldwide.
Take a moment and jot down on a piece of paper the first word that comes to your mind when I say to you, what is patient education? We asked this question to two successful practicing dentists, and this is the answers that they gave.
It's an understanding on the part of the doctor to understand his patient.
An understanding between two people.
Take a moment to answer this question. How does patient education fit into a successful practice? Again, here's the responses from the practicing dentists.
To me, it's part of the meaning of the title doctor.
Patient education is the backbone of a viable practice.
It's pretty exciting and it's pretty rewarding.
When I go home at night, I want to feel good.
This tape will deal with the role of patient education in the practice of dentistry. Several myths surround the area of patient education, including difficulties in terms of collection of fees, low fees, difficulty in third-party payments for patient education, and inability of the practitioner to be able to communicate successfully to his patient. We wanted to take a look at some of these myths and some of these difficulties that seem to exist in patient education, and wanted to find out why it is used, and what its function is, and what its purpose really is in a good dental practice. To look at some of these issues and to answer some of these questions, we visited several successful practices throughout the state. In conversations with these practicing dentists, we posed the question to them, in spite of all of these difficulties and problems, why do you do patient education?
I think that as far as our practice is concerned here, nothing really happens until we have some kind of patient education. I think that patient education is the backbone of a viable practice.
Why do you still keep up with patient education? Why do you need it?
That's a good question. At times we wonder. I think this has become even more important that we are effective in our patient education probably since the middle 60s, when the emphasis started to move toward prevention. And then we started to look at the problem, and we thought we were doing the job, at the chair with hygienists and teaching home care procedures. And when we really evaluated what we were doing, we were very ineffective. And then we got all geared up and enthused about effective patient education programs. And the more we worked with it, the more excited we became about the results and about the long-term relationship that we could establish with that patient, that the end result can be excellence in dental care. And we don't have to settle for any mediocrity. But in order for this to happen, we've got to be effective in the way we motivate the patient to make a behavior change on their part and to maintain their mouth in a healthy condition until such time as we can do the finest possible dentistry for that patient. It's pretty exciting and it's pretty rewarding.
To me, it's a gut feeling. It's an important reaction. To me, it's part of the meaning of the title doctor. And if I felt when I came from school, as I still do now, that one of the most important things I can do is to prevent disease. And I know that without patient education and without an oral hygiene program, I can't do that. It's more than that, really. When I go home at night, I want to feel good. And if I've been here and I've just been plugging amalgams or doing crowns or whatever I may have done that day, it's a mechanic. And it's strictly a mechanical occupation. But if I have been able to help someone, then it becomes a benefit, and then I feel better.
Patient education can mean different things to different people. For some, patient education is simply toothbrushing instructions for a patient. To others, Patient education is a relationship between doctor and patient. We asked this question to these successful practitioners. What is patient education?
I think probably the first thing that you need to do is define patient education. I think that ordinarily we think of patient education as the things that happen in relation to toothbrushing or home care or getting a patient to do something that we want them to do. In other words, in my case, wear an appliance of some sort or other. But I think really and truly patient education happens the minute that a patient walks in the door, or sometimes before that, the minute that we have contact, telephone contact or first contact with a patient. So I think there are a lot of facets of patient education that we don't always consider. And I think that as far as our practice is concerned here, nothing really happens until we have some kind of patient education.
I used to think it was all those things, and now I think really it's an opportunity. It is simply an opportunity for the patient to learn the techniques, the concepts, the things that the patient needs to learn to be able to keep his natural teeth for a lifetime, because that's the goal, the stated written goal of this office is to help all of our patients keep their teeth, their natural teeth, for a lifetime. So it's an opportunity for them to learn how to do this.
What does it mean to the patient sometimes in terms of this patient education? Do they seem to accept it?
Well, it varies upon the patient and upon the way they come in. Everybody comes into the office at a different level, at a different state, and some people are ready for it immediately, and yes, they accept it immediately. And they say, oh, doctor, I've been looking for this, and why hasn't someone told me this before? And I've heard that so many times. And they say, doctor, oh, this is marvelous. And other people come in and say, no, doc, just come on, let's go and double park. Let's get this thing over with. So I really can't answer that. The patients come in at all different levels.
What's the most important thing that comes to your mind?
Getting back to probably the same thing, an understanding between two people. Patient education is, I think, first of all, we've got to have some open pathways. I think in the past we used to have a mobile cart around here that had all the visual aids, and someone sat down and we just came in and said, we're going to give them patient education. And we went down the list. This is the patient education. And we were dumping it out, and we were feeding it, but the patient wasn't receiving it. And I think the key to effective patient education is an understanding between the patient and the whole office and the philosophy of the office, rather than the individual dentist. So that once that understanding is there and the lines of communication are open, then when we explain to the patient that a problem exists and there are some possible solutions, the natural follow-up on the part of the patient is, what are the possible solutions? And that's the time you say, this is what we're going to do. We do use some visual aids. We use some film strips. I think they have to be used with a lot of discretion. I think they have to be very carefully introduced. I think the problem has to be, if I'm going to show you a film strip about something that's in your mouth, I must identify to you on the model's x-rays in some way, this is the problem that you have. You see, where we have bleeding, this film strip talks about how we can stop this problem. So we just can't indiscriminately be dumping patient education materials. That doesn't do the job. But I think if we identify a need for that vehicle that we're going to use, it makes sense to the patient.
It's obvious that these practitioners believe in and use patient education. The next question that we were interested in was, what benefits does patient education have to the practice and to its patients?
I would have to answer that in two ways. The first way is that it helps very substantially to create an area of trust between myself and the patient. One of the most difficult things I found in dentistry is to talk to a patient and to tell them what you think should be done and to have them accept it. Well, if I've been able to show them, first of all, by my emphasis in their health and in controlling their health, that I am sincerely interested in them as a person and in them for what they are here, then it makes it much easier to present a case. And there's a second part to this too, and perhaps somewhat more selfish, but still in their best interest. If I do a crown or a very nice bridge or a silver amalgam restoration, I know that restoration is going to last. And I can tell that patient that the work we do and the teeth that they have should if they do their part, keep their responsibility, last a lifetime. So it makes it easier to do dentistry. There's much less hassle.
Of course, in the process of improving the patient's dental health, it feeds all the people that work here, too. I guess that's the main thing that we need to do. It's kind of a two-way street. I think the patient education is the thing that makes us go around.
And in a dental practice, I think it's important that we realize that it's a staff working as a unit, and it's a philosophy that we've sort of come to as a group, and that everybody in the group understands exactly what we're trying to accomplish, so that if one person happens to be teaching a plaque control program with a patient one day, someone else can fill in the next day, and it'll be continuous. We're not going to have different ideas being taught. I think everybody in the group has to understand what our overall goal is, why we're approaching each session. That's why we have to have our staff meetings. That's why we have to have newsletters and lots of communication with the group.
In terms of the patient himself, I think the patient is directed towards being encouraged to maintain his own. He has to realize that his own dental health is a result of his responsibility. So he's encouraged to do to have his dental work done properly, to take care of his mouth and his needs in his mouth, and to maintain these corrections once they're taken care of at home.
Our personal benefits, I think the whole staff, we're a lot more excited about what's happening now than, say, 10 or 15 years ago. We've been here for over 20 years. The things we're seeing happening, when you can see patients on a recall basis who have been trying to do a good job, and when they were coming in years ago and seeing our hygienist every 3 or 4 months, and their mouths needed a prophylaxis at that time, and that same patient, with turning the ball game around a little bit and maybe reassessing some of the responsibility and a little effective education, that same patient comes in, and we see them once a year now, and we have hundreds of patients in this group. They were having a prophylaxis every 3 or 4 months, and they needed it. They now have a prophylaxis once a year, and what they're there basically for is a check on their home care and a check on any dental problems that may have come up in the past year. Now, that's a significant change, and the patients can see that. Now, the advantage to us from the new patients is that we put the emphasis on the patient's responsibility and some hopefully effective patient education early in the ball game, before we start any dental treatment other than pain relief. So that we have a patient that when we start long-range planning, they have already controlled their dental disease. They understand what the problem is, that it's a joint responsibility. We'll take part of it, but they've got to accept part of it.
We know there are benefits to the practice and the patients in patient education. However, even in successful dental practices, we know that problems exist. We pursued this train of thought with Dr. Marcotte.
What problems does it create?
Many.
For your practice?
Many. I think I'd have to say there really are 3. There is a problem of scheduling, very, very difficult, because in this type of a practice where we have people that are at work, that are in business, we have people who cannot come at the drop of a hat, we have to work around their schedule. And it becomes rather difficult to have the necessary, the numbers of personnel needed to handle this kind of a situation. The other thing is money, because when you start telling people it's going to cost to come in for this type of thing, you'd better be able to substantiate and back it up. In essence, money, I would have to say, it's a losing kind of a proposition. The third problem is personnel, and that is that the people who come here and who work with the program must be totally dedicated and must be very well trained. But more important than that, you have to have good communion, if you will, with them. You have to know what they're going to say, how they're going to say. You have to know what they're going to say to different people to make sure that it doesn't destroy the practice that you've created from a patient management concept.
It creates a lot of problems. There's no doubt about it. I think that probably the problems that we come face to face with most often are financial problems, problems of how are these things going to be paid for, and I think that happens. Probably the biggest problem is the home care program. How is that to be financed? How are we going to pay for that? How is that going to be paid for? And I think the other thing is acceptance, patient acceptance. If the patient isn't ready for a home care program, if the patient isn't ready for a treatment plan. If the patient isn't ready for the dental needs that arise, then nothing happens.
In this tape, we've been able to see that patient education is an important part of a successful dental practice. We've been able to see the important benefits to practice and patient, and along with that, we've seen the problems that exist. Think back to the responses that you jotted down to the question that was asked at the beginning of this tape, and compare your responses to the concluding responses of the practitioners.
If I were to kind of throw out to you the statement, what do you feel patient education is? What is patient education? What would your sort of gut response be?
Understanding. It's an understanding on the part of the doctor to understand his patient and what really makes a successful practice work, because the patient then is going to understand enough to tell him. And the patient understanding is so critical and so important to any kind of a successful practice that patient education gives that understanding, and I think that's what it is, an understanding.
A patient can be guided and directed, but until the patient is ready to accept what I'm willing to give, then nothing happens.
This may sound a little strange, but as it hits me, the more we work at it, the more I think the patient education is the establishing of a relationship, an understanding between two people. Once we have that understanding, I don't think much can stand in the way. We may be ineffective, we may be clumsy in the way we do it, but if that patient knows that we have their interest at heart, that they have a problem, and that there are possibly some solutions to this problem, how we actually go through the mechanics of getting those solutions, and we may stumble and we may miss and we may do it wrong, but if we have that relationship, eventually we're going to get to a point where we'll get optimum results, or at least the best results we can expect if we're trying to make behavior modification. And I try and watch my weight and I get overweight, but at least I'm aware of the fact that I've got a problem and I should be doing something about it, and I try to do things from time to time. But I think it's basically a case of establishing a relationship, and if once we get that, I don't think it really depends on extremely how effective that program is. For example, with Jan, if when a patient goes in and starts a 4 or 5 day plaque control program, that type of patient that has a problem, we've identified the problem, the patient walks in and says, "I wonder why I'm here," we fouled up right there. We didn't have a relationship, we didn't have an understanding that a problem existed. And we can't expect our hygienist or control therapist or anybody else to be effective in that situation, because we threw them a loaded shot. There's no way that they can really relate to that patient and get something across, because we, who started out trying to deliver the message, didn't get the message delivered, didn't have that relationship established. So I think, in answer to your question, what's patient education? It's a relationship, and from there on, it's creating an awareness of a problem. There are some possible solutions. Responsibility can be partly the dentist and the office staff and partly the patient. From there on, it's some techniques that'll get the job done.
In this tape, we've been able to see that patient education is an important and even critical part of a successful dental practice, and that it's being implemented in a successful practice in spite of the fact that there are difficulties and problems. We can say that patient education is a critical part and a backbone of a successful dental practice.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.